Hello everyone. Today's video is about the safety of neurofeedback. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So somebody posted a question on one of my other videos asking about neurofeedback. I've posted a couple of videos about the neurofeedback now, and the question goes like this. I have been so scared to try neurofeedback because my brain was stuck for years in a pre-seizure seizure state due to the mold damage in my brain. So I'm afraid to mess with the electrical current of my brain. What are some of the possible negative side effects of neurofeedback? So thank you for the question. I just have to close my computer because there's a video of me in that video right beside the comment on my Instagram page, and man, it's really distracting seeing myself in my peripheral vision yapping in an analogous video to this one. So thank you for the question. It's a really good question, and I mean, at the end of the day, whenever there are seizures or pre-seizures or seizure-like activity that's like not an actual seizure but it feels like a seizure, anytime we're doing any kind of therapy that has an impact on the brain, particularly directly on brain waves, we want to be extra careful. So if the person asking this question, if you're listening to this video, if you are going to consider neurofeedback, you would definitely want to have an in-depth conversation with the individual who you are going to do neurofeedback with, and talk this out. If somebody came into my practice and they had an analogous story, had some kind of pre-seizure types and issues going on, and mold toxicity and all of that, I would definitely approach that case really cautiously. It wouldn't be something that would, in my opinion, preclude a person from pursuing neurofeedback. Interestingly enough, to my understanding, the original applications of neurofeedback directly related to helping to try to mitigate seizure activity. And to my understanding, and this isn't something I specialize in my practice by any stretch of the imagination, but to my understanding, neurofeedback can be successfully implemented to help control, or in some cases resolve, seizures. So this history of seizures, or history of pre-seizures or whatnot does not preclude a person from potentially pursuing neurofeedback if it seems to be indicated in the purview of the clinician that they're working with. So that's the one thing that I wanted to mention. I mean, over and above that, as far as other side effects from, or potential side effects or adverse reactions from neurofeedback, so that's the other part of the question. Neurofeedback, I'm talking all day, so a little mushmouth here today. Neurofeedback is generally a well-tolerated therapy. We've been doing neurofeedback on many patients in my clinic, and even folks who are really sensitive to a lot of things, who react to a lot of supplements and medications and whatnot, a majority of them have tolerated the neurofeedback just fine, which has been lovely, because finding therapies that sensitive folks tolerate is just it's a gold mine, in terms of it's exciting because it helps us to it actually gives us tools that we can use. One of the most challenging things for both clinicians and for the sensitive patients is it's like, oh, we kind of have diagnostics, we have lab tests or things like that telling us what's going on, what's wrong, but if we can't use the actual therapies, it's really limiting, and so it's very valuable to be able to use neurofeedback in folks who are really sensitive. So even in really sensitive folks, it's generally been well tolerated. The side effects that I have seen, though, because there are some side effects that can come up, largely kind of the way that I conceptualize it is that it largely stems from asking the brain to spend more energy than the brain has resources to spend, those energy resources to spend. So if you think at it through that lens, like, okay, so person's brain is being asked to do this work. It's kind of like neurofeedback, sort of like as lifting weights would be for the muscles, neurofeedback is for the brain. It's kind of remodeling the brain tissue, just as lifting weights is going to kind of remodel the muscle tissue, so to speak. And so if we're doing a neurofeedback treatment and the person's brain just doesn't have quite enough extra energy kicking around to make all of those remodeling changes, well, then the person's going to maybe feel brain foggy. They're maybe going to feel tired. They're going to maybe feel a bit depleted. So those are the most common symptoms that I've seen. I've only seen this in one patient so far, what I'm about to say, although it's like a, not common, but it's a it doesn't happen all the time, but it's amongst the more common side effects that will happen if a side effect is going to happen, and it can lead to a lower or depressed mood, and that's something that will typically be more cumulative over time and seems to be related again more to this just the brain's being asked to spend more energy. There's just not as much energy kicking around, and that seems to maybe interfere with the ability to synthesize enough serotonin or dopamine or whatnot to help keep the mood more uplifted. So in that one patient that I saw this happen with, they had done a few treatments, and they emailed me saying, like, just my mood is kind of like, they weren't like, falling apart at the seams with depression or anything. So, man, my mood is definitely on the lower end of the spectrum over the last, couple of weeks. Like, what do you think is going on? And so I said, okay, I think we're, brain training you a little bit too frequently. So that is another possible side effect that could come up. Another possibility is that if a person was working with a very targeted or very specific neurofeedback protocol that was really just not something that they actually needed. So in other words, if say they were working with a protocol to help upregulate the amount of beta brain waves in their brain, and in reality they actually have enough beta already, or maybe too much beta, that could really rev up their nervous system. Betas are highest energy brain waves, so if a person didn't have a brain map done ahead of time and they went on a very specific upregulating protocol for beta, for example, that could potentially cause anxiety, cause insomnia, things like that, because we really do meaningfully change a patient's brain waves when we're using neurofeedback. And so if we kind of manipulate them in the wrong direction, that's not going to be good. And so that's why ideally, if a person's using very like if a clinician's prescribing very targeted neurofeedback, say I want to specifically elevate your delta or elevate your beta or lower your alpha or whatever it happens to be, they ideally would do that with having run a brain map ahead of time to see exactly what are those brainwave patterns actually looking like. There are some generic neurofeedback protocols, though. There's one called uptraining the sensoromotor rhythm, or the uptraining SMR for short, at the CZ location, which is right at the vertex of the head. Or there's this other protocol called the TBR protocol, like the theta beta ratio protocol. There's various protocols that are just generally brain balancing protocols. They don't specifically upregulate beta or delta or this or that. They're just basically working to help improve those ratios, or just upregulating certain internal structures in the brain. And that's something that a lot of studies have been done where they don't brain map ahead of time. They just use these kind of empirically determined protocols, and they can be helpful for a wide range of different conditions. You look at the research literature, and it's like, oh, this, upregulating the SMR protocol, which is a very, very popular neurofeedback protocol, it can be applicable in folks with an ADHD diagnosis, folks with an MS diagnosis, folks with a Parkinson's disease diagnosis, folks with post-concussion syndrome. So like it's a kind of a broadly applicable protocol. So if somebody listening to this is saying like, oh my gosh, like I've been doing neurofeedback, I've never had a brain map, like are they doing the wrong protocol for my brain? If it's a more generic protocol, then it would not require a brain map being done ahead of time necessarily. So generally speaking, neurofeedback is a very safe therapy, but there are the possibility of some side effects. But generally, if the length of neurofeedback sessions is appropriate, and the spacing between appointments, like between sessions, is appropriate, it should be quite well tolerated. If it's not, then the protocol itself can be modified, and the length of time can be modified, and the frequency of treatment can be modified. So should be able to, in my experience, and to my understanding, a vast majority of folks should be able to tolerate neurofeedback very, very well. There just might need to be some modifications made along the way. So thank you for the question. I hope this answered your question. If anybody has any questions about neurofeedback, brain mapping, or any other topic related to health, please feel free to post in the comment section below, and I will do my best to answer as soon as I can.